most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about 7 rotator cuff exercises for pain relief. These are non-surgical options, I was going to say.
Oh, absolutely.
Non-surgery rehab.
Right, if you,
The same thing.
well, let's go on.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section.
That's right.
Always giving something away. This week we're giving away the Booyah Stik.
Booyah!
Yeah.
But don't do that with them. That
You'll
wouldn't
find
be
out
safe.
why it really becomes handy later on in this video. Also, go to Facebook, and it'll be pinned to the top of the page, the contest that is.
Yes.
You go to Twitter, Instagram, or TikTok if you
TikTok.
want a 60-second version of our program where we don't ramble, Brad.
That's right. And you can always fast forward on these if you don't like our rambling and get to the exercises. But are we going to carry on?
No, we got a podcast too.
Oh, that's right. Our podcasts are out there, and they're very good. We've got a lot of really highly intelligent authors, PhDs.
As opposed to us.
Yeah, exactly. It's a good contrast. Anyways, shall we carry on?
Yeah.
There's 7 exercises, and we're going to show. 3 of them are stretching exercises specifically for the shoulder and rotator cuff. 4 of them are strengthening exercises. What I like, if you want to go through this and do it properly, you're going to go through all 7 of them and only do the ones that clearly make your shoulder feel better and or increase your range of motion in a pain-free range.
Yeah, we don't think you're going to need to do all 7.
No, you'll probably pick 2 or 3.
Right.
And maybe 1, but I would think probably
It's
2 or
better
3.
for you to do 1 or 2 every day consistently than to go, all 7 and go, oh, I can't do
Right.
this.
And it's very possible 1 or 2 of them may irritate it.
Yeah.
And then for sure you don't want to do those. So first, before you get started on this, your shoulder hurts. I want you to find out which motion makes it hurt.
Right.
Specifically.
So is it flexion?
Yeah. A lot of people,
straightforward?
it will be here.
Yeah.
And oftentimes when you get about to here,
Painful arc.
or coming down is oftentimes
Right.
a one. My shoulder issue did not have that, but I had the problems doing one of the exercises, doing this particular exercise, which is a little unusual.
That
You
is
don't see that very often in the clinic, but it happens. So find out which motion hurts. Maybe out to the side here, this, reaching behind, or like this. And then you're going to go through each one of these. And if it is up and coming down after the first exercise, test that range of motion again and see if it feels better as a result of the exercise or worse.
Basically, you're trying to establish a baseline.
Yep.
You want to know where your pain is and when you feel it.
Exactly. So we'll go on to stretching first. Okay.
Okay.
The extension, as a matter of fact, this is the one.
You are now calling it paddler.
The paddler. Yep. There's a different ways to do it, but it's just doing this. And this exercise, specifically, I could do 10 of those in a row, and then I could do these again afterwards. I had better range of motion
You
and,
could do
and
this
less pain.
before.
Without pain, yeah. It hurt right in here.
But once you did these.
Are you going to interrupt me again, Bob? What's the deal? Anyways, maybe I should keep my mouth shut. I don't know. But yeah, I would do 10 of these paddlers, and then this was easier. It wasn't fixed, but I could go farther with less pain. So I started doing the paddler. Now you can talk.
This, by the way, is a McKenzie exercise.
It is.
Let's give credit while credit is due.
Exactly.
Robin McKenzie developed these exercises. This one in particular.
Right. And just do 10 of them.
Right.
Would be a good option.
And you could do them throughout the day.
Right. Not just once you establish they're a good exercise, and that always makes me feel good. I could do that 5 to 10 times a day.
The first time, the first day, only do it once.
Right.
One set.
Yeah. And that goes with all of these.
Yeah.
You want to show number 2? Because I think you're the...
Sure.
I don't know if you invented it, but as far as we know, you did.
The chicken wing, now you can actually just start by pulling up your back a little bit, Brad. So
Yeah.
you're actually, I'm going to put this as my painful shoulder, and my palm on the upper hand is facing to the wall away.
Yep.
The palm on my lower hand is facing out towards
Right.
you. So what I'm going to do is I'm going to just work on bringing it up like this. I'm already hitting the ceiling, aren't I?
There you go.
There we go.
It happens to me at home too. So again, painful shoulder here, and a lot of times a painful shoulder, you have a hard time reaching up like this for dressing and whatnot. This is a good stretch for that.
Right. And that's where this Booyah Stik works out great, Brad, because it's nice and smooth.
Yeah, because it slips on your clothing, and if it doesn't slip, it's very difficult to do that.
So then to add a little twist to it, you actually can push it out like this.
Why don't you go profile and they
Sure.
can see that this range right here.
And I'm not going like this. I'm bringing it down so it doesn't hit my head. And I'm repeating.
Right. Typically 5 to 10 reps.
Sure. I wouldn't do this if you are prone to dislocations or you have rheumatoid arthritis.
If
You
that, yeah.
You're really kind of loose ligamented.
And again, if it creates pain, you stop doing it and go to the next one.
Right.
Which is a Statue
of
of
Liberty.
Liberty. Yeah. Depending on how high you can lift your shoulder, if you can get up to here and you need to get up to here, you probably do it seated like this with the stick on the chair. You'll reach up and then grab the stick with securely and lean forward. Now the stick has to really grip tight to what it's sitting on so it doesn't slip out.
That's why we have the rubber tips on
Yeah,
them.
and they work very well. And you lean forward and stretch.
Plus, this material is kind of grippy. Notice that?
Yeah, yeah.
More than PVC piping. It's
Yeah, your hand doesn't slip on it. It works
Right. because
extremely
you don't want
well.
to do.
Yeah.
You want to show
right.
that, Brad? How you
Yeah,
don't wanna-
I did have a patient. I didn't explain it properly the first time. And he was doing this. He says, it's not working very good. And I said, I'm sorry, I'll have to clarify it. But if you only can go this high, you may start here
Right.
and do the same
What's
thing.
nice about this, you can actually use your hand to crawl up.
Yep.
And
Finger
then-
walking.
Yep.
Yep.
And then go like this, and then try it again, and just work your way up.
Yep.
People with arthritis love this because they can see the progress.
Mhm.
It's easy to do,
And
and they
it-
come back and they're really proud. You know,
Yeah.
I was only lifting this, and now I'm up
Yeah.
here.
Yep. So now let's go to strengthening exercises, which you may pick. Probably in theory, you'd want to be able to get one stretching exercise that makes it feel better and work
Sure.
better, and then one strengthening exercise. The old go-to that most therapists would probably agree is this external rotation, right, Bob?
And that's why I was a little bit surprised, Brad, that this one bothered you.
I was too, to be honest with you, because I thought, "What's going on?" But I've got a different problem than the average person. I'm just not average or
Yeah, Brad is a
weird
little
or
bit of a baby.
oddball. So, anyways, the elbow needs to be by the ribs,
Yep. You
not
don't want it
this,
flying out, winging.
Yep. and not this. This is a common
Yep.
error. You want this motion to
Yep. strengthen
strengthen the posterior aspect of the rotator cuff, whatever, the back of the shoulder. And 10 of these.
Some people do put a towel there.
Yeah, I do that a lot with my patients on the first day, and once they figure it out, you don't need it, but you put that there, and I say, now if that towel falls out, it means your elbow was too far away from your body.
So then we cut their elbow off, right? I do.
That reminds me of that Saturday Night Live flick. Anyways,
Okay.
make sure you do that. You don't have to do it on both sides. You can just do
Yeah,
it on the
You're
sore
doing
shoulder.
outies, not innies.
Right. So next one, scapular retraction is the same thing. As you need, some resistance. Hook it up. The bands always come with one of these that go in a door, so you don't have to have a wall anchor. Wall anchors just happen to work well, and we use them a lot because it's so convenient.
The point with the shoulder here, Brad, is that the scapula or the shoulder blades are a big part of the shoulder and how it works. And
Yeah.
that's what he's working on right now. He's working on basically the base of the shoulder. It's getting
Yeah.
the foundation of it.
There you go. Yep, exactly. If the foundation isn't in the right place, the rest of the joint
Right.
has problems.
It doesn't work. You want me to do the next one, Brad?
Yeah, absolutely.
So you can actually do this with a stick, or you can do it with a table. And we used to teach it always with a table to start off with.
Right.
So you lean down like this, and you're actually going to step back and push down into the mat or into the table at the same time, and then walk your way back up again.
Yep.
But start by pushing down, pushing down, pushing down, pushing down, and leaning like this. Now you can also do it with the stick.
So the idea is the shoulder is going up while you're pushing down. It relocates and properly positions the humeral head. So I'm pushing down, and that muscles pull the humeral head into position, and then I go down like this. And if I come up, I've changed my range of motion from here to here.
Sure.
And this one, I've found it either works good,
Yeah.
or people don't have
It
good
doesn't
luck
help
with
at
it.
all.
Yeah. So.
It was developed by Brian Mulligan.
Yep.
Both Brad and I took a course from him. Quite a character.
Yeah, yeah. He's a physical therapist from
New Zealand.
He's a New Zealander
Yes,
too.
he is.
Yep.
A lot of great therapists from New Zealand, Brad.
Exactly. The next one, and this is a strengthening one
Yes.
of a different
I
variety.
like this one too.
Take a ball, a squishy one, 6-8 inches in diameter, put it up against the wall, and you're going to put weight through it. So we're getting some weight bearing co-contraction of the muscles, which is really important for function. And I'm going to go up and down like this, and you can time it for 30 seconds. You'll be amazed. This
How
gets
much
you more
you're-
tired. than you
Right. How
think.
much your shoulder is working with this.
Yeah. And then you go right to left. Circles this way for 30 seconds and 30 seconds this way. Now, I found a lot of people rehabbing will up and down may be good. One of these directions, oftentimes it seemed like a circle. They say, oh, that hurts. So I say, stop
Sure.
doing it. Give it some time, but keep working the directions
They
that
were
don't
better in
hurt.
the other direction. They hurt one direction and
Yeah,
was better the other
yep.
direction.
Yeah, and
So.
it would vary. I mean, I can't specifically say clockwise or counterclockwise, but
Sure.
the rule is the same. Only do the directions that do not irritate it. And time, things will get better, and you can do all of them.
My apologies, by the way, to the kids that Brad stole this ball from.
Well, they said I could have it.
No, they did
They
not.
did too.
You were running away.
Yeah, I told them I was Brad from Bob and Brad, and they said, "Who?"
And they threw it and hit him in the head, and he ran away with it.
Whatever. They're all good.
He's
kids.
that grumpy old guy that
I'm
if
trying
you
to-
throw a ball in his yard, he keeps it.
Yeah, I like the movie Sandlot.
Yeah, Sandlot. That's
got the
right.
big dog.
That's right.
Anyways, be careful
Thanks
and
for watching.
everything that you do.